WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisEye to 44321.
Alison Page of River Falls is the Democratic candidate for the 30th Assembly District. The election is November 5th. Alison Page, welcome to WisconsinEye.
Thank you so much. Happy to be here.
Why are you running for this office? What's your campaign's key message?
My key message is, my goal really is to make Western Wisconsin, to make all of Wisconsin actually, a great place to live, work, and play, and especially a great place to raise a family. My thinking really is that if we make Wisconsin a great place to raise a family, everything else kind of falls into place. We'll bring workers into the state, our economy will grow, a lot of things will just self-correct if we really, really focus on families.
So if you're elected, what's an example of a bill that would be a priority for you to introduce?
Well, there's so many things I'm interested in. Obviously, as a healthcare person, I'm very interested in healthcare. But for working families, I think the most important thing that they're facing right now would be housing costs, the cost of living. One mom shared with me the other day that she's quit adding up what her groceries are costing her. She just knows at the end of the month there is no money. Childcare costs. So what are the things that we can do to really support? So that's not one bill. I'm sorry, I'm not answering your question.
Do you have a specific idea or policy change?
I don't, but I'm very much in favor of looking into what kinds of things we can do legislatively to make housing more affordable and more available to families and to bring down the cost of things like daycare. Daycare, for example, like right now it costs to put one child in daycare for a year is about the same as I spent sending one of my kids to UW-Madison for college their first year. So that's a lot. It's a lot, and daycare providers need to be paid well. So how can we help? What would that legislation look like? I am with all things, I never go into any problem with a specific answer in mind. I go in with questions and curiosity on learning what are the possibilities, what are the real problems, and what are the possibilities. Let's get all the possible solutions on the table and then talk about what's right.
So if you're elected, you're entering during a biennial budget year. The state's now projected to have more than a $4 billion surplus. What are your top two priorities for use of that surplus funding?
Well, there's actually three things we can do with the money, right? We can spend it, we can save it, or we can give it back. And I'm in favor of looking at all three of those. I've run big budgets as a member of a senior team of a large health system and then running a 50-60 million operation healthcare organization in St. Croix County. My motto always, and I said to many, many people, is the boat's got to float. So the boat's got to float. We have to make things work. So my priorities would be investing in things. Maybe we invest in some things that don't have immediate return on investment. You want to be careful when you're spending money that you're not adding to future expenses that you're not going to be able to afford down the line. So what's the balance of giving taxpayers money back versus investing versus saving for that rainy day fund? There's nothing wrong with having a healthy balance in your checkbook that you can use for when things come up.
So where do tax cuts or tax reform fit within your platform? What does that look like to you?
Well, the taxes that people feel the most are those local property taxes. Our income tax rates are not, comparatively high to other states, but people really feel those real estate taxes, and there has been a shift, as we know, in how schools are paid for, where a little more of that burden is falling on to the local taxpayers. So providing more relief there.
On property taxes?
Property taxes, and really backing up. We could talk all afternoon on on what we should do with school funding, but really needing to back up when you're looking at something that is between 30 and 40% of our general fund is spent on education. How do we back up from that and say, what is the most fair way to pay for our public schools, and how should we do that well?
So you're leading into my next question, which is regarding K-12 education. What are you hearing on K-12 education, and what do you think are some of your priorities in that area?
Well, education is one of the things I'm the most interested in. I served on the River Falls School Board for 17 years when my children were growing up. I'm back on the River Falls School Board right now, and how schools are funded is a big deal. So as we look at what do we do about that, what do we do about school funding, again, I think we need to back up and say, what are our priorities? Back up to our Constitution. Our state Constitution says that Wisconsin will provide an education, will work with communities to provide an education that is as equitable as possible for every child in the state between the ages of 4 and 20. The impact of what we're doing right now with funding our schools and shifting it onto the property tax owners and saying to school boards, you're limited in what you can spend per child. And if you want to spend more than that, you have to go out to the public and ask them to approve an operating referendum. And then the full amount of that operating referendum isn't paid for by the state coffers. It's paid for out of the local real estate taxes. So what's happening across Wisconsin right now is a path towards inequity in educating our children statewide. That needs to be corrected. I feel it is in complete violation of the intent of our state constitution.
What about the state's higher education system, the system of 4-year colleges, 2-year colleges, technical colleges? What does the future of that system look like to you, and what should the legislature focus on?
Well, first we need to recognize that our university system, our colleges, our tech colleges, our 2-year colleges, these institutions are a cornerstone of our state. They're an economic driver of our state. Whether you ever step foot in one of our universities or not, you benefit from the existence of that university. The research that gets done there, the businesses that are spawned because of the research that's done in these institutions, we all benefit from these institutions, and they need to be accessible. I remember when I was running for state senate, I've run for office twice before. When I was running for state senate in 2008, I went through many, many towns in western Wisconsin, all the way up to Grantsburg, down south of Prescott. And you meet so many different people. And I would say, well, where'd you go to school? Where'd you grow up? Where'd you go to school? And so many of them said, I graduated from UW River Falls. UW River Falls, in the town I live in, I live a block away from the college. It's a cornerstone of our community. It's a cornerstone of our region. It's where people are getting their education to become leaders and productive citizens. So the funding, if we've watched what's gone on in the last 14, 15 years in Wisconsin, our university system, our higher education, is being systematically underfunded. We have dropped in the nation from making large investments in our system to now dropping towards the bottom of the country. To get us up just to being middle of the country in how we support our public institutions of higher education, we'd have to invest about $800 million a year.
And do you support that?
I do. And yes.
What do you see as the state's largest workforce development challenge, and how would you propose to address it?
Well, we all know, like every state in the country, we know that we're going to have a shortage of workers. It's coming. It's like the Mack truck coming down the highway right at us. What are we going to do about it? The birth rate in the state of Wisconsin, we're not producing, if you want to think about it that way, we're not producing enough workers, right? And so what do? We need to bring people into our state. Again, back to the answer to my first question, if we make Wisconsin a great place to live, work, and play, we will have people driving here to bring their families here, to raise them here, to work here. So it's a combination of attracting people to our state to work and making this a great place to work by having businesses that provide family-sustaining jobs, right?
Is there a policy change that creates that condition?
I don't know of one yet, but again, like I said, I'm very open to all possibilities. I don't approach things with coming in with the answers. Part of my training as a hospital administrator is to solve problems, problem solving, and we always start with what don't we know, what do we need to learn, what are the facts, what are the issues, what are all the possibilities to look at that, and then how do we work with others to get consensus around these solutions. So I would not intend to go to Madison with, this is the way, this is the only way, it has to be my way.
I have a few more workforce questions for
Yeah.
you. Investments in public and energy infrastructure grow our state's economy. This also provides an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
Right. Well, to answer your question directly, I would have to think a little bit about whether it should be required or incentivized. I can tell you that as a hospital CEO in western Wisconsin, we built a brand new hospital right on I-94 at exit 19. And when we built that, we very purposefully hired a Wisconsin architect, very purposefully hired a Wisconsin construction company, very purposefully hired a Wisconsin engineering company, and we looked to buy things in Wisconsin. The brick was from a few miles down the road that built the whole building. So I think, and I had no incentive to do that, it just felt like the right thing to do for our state and for our community, keeping those jobs in western Wisconsin, keeping them here.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, and it puts compliant companies at a disadvantage when bidding on projects.
Yeah.
Plus, misclassified workers may be denied minimum wage protections or overtime pay.
Right.
Are you aware of this issue and what should be done about it?
I'm well aware of this issue. It happens in every industry. I've seen it in healthcare, and it's wrong. It's just wrong, and I would not do that personally as the CEO of a company. But I don't think it should be allowed.
There should be some state policy change.
Something.
You mentioned housing. Affordable rental housing is an issue in Wisconsin. Some support government-imposed rent control to maintain affordability, while others argue keeping rent artificially low will decrease rental supply, resulting in increased prices. What is your sense of housing as an issue and which best addresses rental housing affordability? Is it rent control, building rentals, or some other solution?
Yeah, there's a lot to think about there. So housing is definitely an issue. I was thinking, and it's not just rental; it's buying housing. Can I speak to that a little bit as well?
Absolutely.
So if you look at minimum wage, now our minimum wage in Wisconsin is $7.25. It's been that way since 2009. If you go back to 2009, the average rent in Wisconsin was about $800. Right now, the average rent in Wisconsin is about $1,500, but the minimum wage is still $7.25. Now, lots of businesses, because of market dynamics, pay more than that $7.25, and that's good. But think about being a young person getting out of high school. Maybe you want to work a couple years, get out of your parents' home, and can you do that with the rent being that way? Same with housing. So when I was in my 20s, I was a registered nurse. I made $15 an hour. My husband decided to leave his job, go out on his own. I needed to make some money now. I went to work. We bought the cheapest house in River Falls, Wisconsin. That day was $42,000. I made $15 an hour. Roll that forward. If I went through that same experience today as a registered nurse, I'd be making $45 an hour. That house, I just looked, was recently sold, the same house, and it wasn't a very special house, $244,000. Okay, so that's about 5 or 6 times as much when the pay went up about 3 times as much. So what people are dealing with housing costs is very, very real.
What's the state's
solutions?
role here?
Yeah, the state's role and the solutions are really 3 different dimensions. It's why are people not building that entry-level housing, rental, lower-end housing? What's going on with the housing and construction industry that they're putting more of a focus on high-end homes and not building the lower-end homes? Probably has to do with, that business, the profit margin, whatever. But it also has to do with the jobs and what people can afford to pay. So it's the availability of the housing, the cost of the housing, and the ability of the person to afford the housing.
So the state shouldn't incentivize?
So I think the state should work on all 3 fronts, work on how can people afford to pay more, how do we focus, and they did do some things last legislative session to create worker housing, which is great. How can we do more of that, and how can we work with construction and builders to really incentivize them to do more of that?
Transitioning to healthcare. Medical systems facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services, and as you know, even the closure of a hospital system here in western Wisconsin.
Right.
What would you do to preserve access to care and prevent future closures?
Well, the closures that happened in Eau Claire really happened because of market dynamics. There's a lot of hospitals in Eau Claire, and when the specialists pulled out of Sacred Heart and pulled out those high revenue, high earnings business out of Sacred Heart, they really had a hard time struggling. What people don't talk about in that situation is the closure of the 15 clinics that went with it. So healthcare is a big challenge. It's frankly one of the big reasons that I am getting into politics is I bring a lot of expertise on healthcare and what can be done about it. First and foremost, it's getting people coverage, opening up regulations about how people can receive health care. Can you do telehealth? How can people receive services? And making those very, very available to people, more available. And of course, it's complicated, but...
do you support increasing the Medicaid reimbursement to hospitals?
Yeah, absolutely. The Medicaid, the refusal or on the part of our legislature not to accept the Medicaid has cost the state of Wisconsin billions of dollars that could be coming in from the federal government. It makes no sense whatever. It's a great example of political games playing that just shouldn't happen.
What about mental health care? What are you hearing on that, and what are some solutions in that area?
Mental health care. So why don't we have more mental health care? I can tell you why. It's because it doesn't reimburse well. It hasn't in the past reimbursed well. And so if you're a hospital CEO and you want to have, a good bottom line at the end of the year, you do more of what makes money and you do less of what doesn't make money. Also, so at Western Wisconsin Health, where I was the CEO, we were a critical access hospital and designated as a provider-based rural health clinic, which is a federal designation. We developed a behavioral health program there that is quite impressive. And we also now are offering substance use disorder treatment, which is a big issue. So mental health care absolutely needs to be available, and it needs to be paid for. If it's paid for well by the payers, then the delivery systems will gladly provide it.
How should Wisconsin move forward on the issue of abortion?
I'm pro-choice, and I can tell you why. I think that in my perfect world, no woman should ever feel like she has to have an abortion because she cannot afford to feed another child, or she cannot go forward with a pregnancy and also go forward with her life, or feel like she can get through this. And so I think those are the things that we should focus on. The facts around abortion right now is that abortion is at its lowest point that it's been. Right now it's about at 11 abortions per 1,000 women who are in childbearing years from 15 to 45. That number peaked in 1981 when it was up at 29. Now it's down to 11. Why? Because of education, access to reproductive health services, and teenagers are actually having sex less. So,
do you support a number of weeks as a limit on abortion?
I am decidedly pro-choice. I think if you look at the abortion statistics right now, 93% of abortions are performed before 13 weeks. 1% of abortions are performed after 21 weeks, and they're usually issues that have to do with the health of the mother, the viability of the fetus, things like that.
Transitioning to transportation. What are the pressing transportation needs in your district, and how important is it that these needs are addressed, and for the state to keep on schedule with reconstruction of aging interstates and corridors of commerce?
It's very important. We would love to see rapid transit all the way up through western Wisconsin and into Minneapolis, St. Paul. A large number of people, when I used to commute to Minneapolis for work, when I was doing that, it was upwards of 60% of people who live in those two counties, Pierce and St. Croix counties, were working across the river. And so having rapid transit would be wonderful. So I'm very supportive of that.
PFAS and other water contaminants are a growing concern for Wisconsinites. Do you see this as an important issue, and how would you propose to address it?
Absolutely, it's an important issue. Our water, if we don't have clean water, what do we have? It should be regularly tested. We should be monitoring it. We should be going, a little pun, upstream from that and looking at why is this happening and how do we take these contaminants out of our water before they ever get into it.
Final two questions. How would you describe the leading differences between you and your opponent?
I would say there's a lot of similarities between the two of us, but the main differences between the two of us are how I approach problems, as I mentioned earlier. So it's the approach and really the priorities. My approach is to go deep, always learn all the facts that I can, get all the perspectives from the left, from the right, from the people who are impacted by any decision that we're going to make, and consider everything before making a decision. That's how I'm trained, and that's what I'll do. I'll never assume I know the answer to anything until I've gone really, really deep. As far as priorities, my priorities will always rest with working families and the children that are living in those families and what is best for them for the long haul. How do we really, really make Wisconsin a great place to live, work, play, and raise a family?
Final question. Let's say you're elected this fall and you get a magic wand you can use in the state capitol to resolve one issue in a way that brings all people, all parties together. What's the issue?
Well, if I had a magic wand and I was going to Madison, I would, there's a lot of people I need to meet. I would remove the D's and remove the R's from after any of their names, and I would require that everyone read a book called Choosing Civility, on how we work together collaboratively to make change for the future. Does that answer the question, or is that not really?
I think so. You're talking about bipartisanship.
Yeah, absolutely, bipartisanship. This is ridiculous. And watching what has gone on, for example, with holding up the funding for the hospitals that are impacted up here. It's not the hospitals that are impacted. It's the people who aren't getting the health care who are impacted. And holding up this funding because there's a tug-of-war between this party and that party is nonsense. And so we need to step back from that and choose civility.
Thank you, Alison Page of River Falls, the Democratic candidate for the 30th Assembly District. The election is November 5th. Alison Page, thank you for talking with WisconsinEye.
Thank you. It's been a pleasure.
This programming is brought to you by our generous sponsors. Thank you for watching.